Lifestyle changes in gout and hyperuricemia. Lifestyle and dietary recommendation for gout patients should consider overall health benefits and risk since hyperuricemia is often associated with the metabolic syndrome. Metabolic syndrome is a cluster of conditions that includes the high blood pressure, that is hypertension, high blood sugar, that is diabetes, excess body fat around the waist, that is abdominal obesity, and abnormal cholesterol levels, that is dyslipidemia. This syndrome increases the future risk of heart attack, that is ischemic heart disease, stroke, and therefore increased mortality. Since weight gain and obesity increase uric acid, weight reduction by daily exercise and limiting intake of excess calories is recommended. But strenuous exercise, which causes adenine nucleotide degradation, and starvation, which decreases uric acid excretion, and dehydration, may raise the level of uric acid in serum and trigger gout. So, for weight management, diet control and exercise should be in moderation. So now the food which should be avoided in hyperuricemia. So from where the uric acid is formed in our body? Uric acid is a metabolite of purine. So what is purine? Purine are the organic compounds which are found in each and every cell of our body because they are very important for enzymatic reactions and they are building blocks of DNA and RNA. They are also part of adenosine triphosphate which is used in energy requiring enzymatic reactions. So purine-rich foods such as meat, fish, especially shellfish, sardines, and anchovies, and seafood, they raise the level of uric acid in serum and are associated with increased risk of gout. So they should be avoided. Among fish, cod, tilapia, or flounder, which can be eaten in moderation, that is 2 to 3 times in a week, if other purine-rich foods are not taken, are okay. Intake of fat, especially saturated fat found in red meat, should be reduced. Lean sources of protein, including chicken, turkey, fish, and tofu, are better choices than beef or pork, and they can be eaten occasionally. Sweet fruits and soft drinks containing high fructose corn syrup should be moderated since fructose may raise uric acid through uric acid production and or decreased excretion. So after food, we will come to the next most common culprit for raising the uric acid, and that is the alcohol. So heavy alcohol drinking, especially beer, raises the uric acid level and increases the risk of gout through adenine nucleotide degradation. So as you remember, adenine is one of the purines. So adenine nucleotide degradation increases uric acid production, and alcohol causes increased lactate production, which reduces uric acid excretion, thus further increasing the blood uric acid level. Taking total alcohol consumption into account, the risk of gout increases after 1 to 2 standard drinks. So what is the diet which is advised? So dairy products, especially the low fat types, increase uric acid excretion. In contrast to previous assumptions, purine-rich plant foods like legumes and vegetables, as I told earlier, broccoli and all, they do not increase the risk of gout. Rather, they reduce uric acid by reducing body weight and by reducing insulin resistance. Mediterranean diet is also recommended. Furthermore, coffee by increasing uric acid excretion and vitamin C supplementation could be considered as preventive measures as those can lower uric acid levels as well as the risk of gout. Eggs can be eaten. There should be adequate magnesium and zinc intake in the food. And probiotics, for example, bifidobacteria, lactobacilli, which are there in curd, they increase purine and uric acid catabolism by gut microbiota, thus decreasing the uric acid level in blood. As far as fluid intake is concerned, plenty of fluid should be there, but you should limit the sweetened drinks and alcohol, which can increase uric acid levels. So that's all, and here are the references. Thank you.